everybody. Dr. Erin Harris here again. Here just to give you guys more information about functional medicine. I want to kind of piggyback on the last video. The last video we talked about what is functional medicine. We were explaining what is functional medicine. In this video, we're actually going to talk about the importance of functional medicine. Why do we need functional medicine? And so let's go back a little bit. First of all, I want to let you guys know that I will be addressing your comments at the end of this video. Some people really didn't leave comments this time, but I will be addressing some things about vitiligo. There was one comment about how to get an appointment with me, so we will address that. And to let you guys know that in the link of this video, you will actually have an opportunity to get online with me live with a webinar once a month. And that link will be in the description of this video. So go ahead and click on that link in the description and you can reserve your spot for a live webinar with me to answer questions. So let's go ahead and move forward. Let's go back. What is functional medicine? Functional medicine is root cause medicine. It is getting to the why of why we have chronic illness. And the why is so important to why we have chronic illness, because that's not necessarily answered in traditional medicine now. And what I mean by traditional medicine is when you go to a doctor, they give you a diagnosis and they give you a medication for that diagnosis, but it really doesn't tell you why you have the chronic illness that you have. So a lot of people, as us suffering from, well, I don't know if it's suffering, but us who have the diagnosis of vitiligo, pretty much you were told you need to go ahead and take a cream, or you can take a steroid cream, or you can use a medication that they use for psoriasis, or you can use light treatments. But the number one thing that I was told as a patient is that it's going to come back, it's going to progress, there's nothing that I can do about it. And that actually wasn't necessarily true. When I found functional medicine, I found a way to help cure my chronic illness. I was able to restore my color. And if you guys go back to the previous videos, those videos actually show my progression of color restoration being restored. I've lost some color, and it's been actually my own fault. It's been because of my own lifestyle choices, because I didn't eat properly, and because I wasn't consistent with just the supplements that I should have been taking, and I was stressing. And we'll talk about stress and how it affects you, and how it affects you with vitiligo specifically, advancing your illness. But that is the why behind functional medicine, or that is the what is functional medicine. I shouldn't say the why, but that is the what is functional medicine. Functional medicine is getting to that deep root cause and finding out the reason why you have vitiligo. The reason why I have vitiligo, as I've explained before, is I was exposed at an early age to a high toxin load, a Mohs toxin, and I found out that I am not able to methylate or activate B vitamins very well, which didn't allow me to detoxify. And I was under a high stress, I had a high stress load, or I was under a lot of stress in college, which led to my first patch in medical school, more stress in medical school, which led to the progression, which eventually, when I lost most of my color, I had an infection. So inflammation was also another cause of my vitiligo. So I just don't want to talk about what is functional medicine. You can go to my previous video and see that. But I really want to talk about right now the why of functional medicine. Why do we need it? Why is it so important that we have functional medicine in this day and age right now? At this time, why do we need functional medicine? So if you guys notice, I'm not at the pool this time. I'm not chilling out, but I am in my office and got a board kind of behind me, and want to kind of explain some things. Hopefully you guys can read my handwriting. There's a little bit of light from the room that I really couldn't help on the board, but I want to make sure that you guys understand the why. The big reason why is, number one, if you can understand and see my handwriting as a doctor, my doctor writing, the number one reason is the patient needs it. We need it. There's so much chronic illness out there. There's so much going on that patients aren't getting answered. We're frustrated. We want to know not just sit in the room and tell me I have high blood pressure and then give me a blood pressure medication and just tell me I'm going to be on that blood pressure medication for the rest of my life. I want to know, is there anything I can do about that? Is there anything that I could change in my lifestyle? Is there anything that I can, change, like add something in? Is there any supplements I can do? And then you'll usually hear, yeah, you can do the DASH diet, which is like the hypertension diet, which really doesn't help a lot. And so, but it really doesn't give you tools that you need in order to change your health circumstances. It doesn't give you the tools that you need to turn that that around for you to say, okay, I don't want to be on blood pressure medication. Is a way that I can get off. And so that is one of the big reasons why is, number one, is we need it as patients. The other thing, as a physician, doctors need it. I did not have the tools to help my patients previously. When I was just practicing and using what I learned as a traditional trained doctor, I didn't have the tools. I didn't know what to do when a person had a recurrent yeast. I thought it was like fake. I thought this person was kind of really, I was like, well, they're kind of, I don't know. I don't know if there really is a such thing as chronic yeast. And now, as a functional medicine doctor, I do know there's a such thing as chronic yeast, and it can cause a lot of issues, a lot of problems that this patient had at the time when I was seeing her. I didn't know how to treat that, 10, 12 years, 14 years ago when I saw that patient. The other thing is doctors are frustrated with not being able to help people. A lot of people are saying, oh, you can just put things in AI now and you can generate a diagnosis for you. You can just put everything out. That's how medicine's going. But there is something about being face-to-face with the patient, seeing how something affects them, digging into their family history, something that comes up that is very, very important that only a doctor can do. But we can't do that without tools that we need from functional medicine. When we get into that deep dive with that patient, when I'm spending 2 hours, 2.5 hours with them, man, I really get a lot of information, and I'm really able to see how maybe something affected them in their lives, and that's something that a computer cannot pick up on. And so doctors need it because we are able now to really truly help patients. So number 3, the healthcare system needs it. Oh my goodness. Can you guys, if you guys knew how much we spent, I'll tell you how much we spent. Back in the 60s, we used to spend, I think it was $500 per year per patient in America. Now we spend $14,000 per year per patient on average in America. And we're supposed to have more technology, more healthcare, better healthcare, and we're spending more per patient. And that is actually it actually includes inflation. And so we're spending more per patient, but patients are getting sicker, people are getting sicker, there's more illness, more chronic illness. You're seeing young people, 30 years old, 40 years old, dying of cancer, breast cancer, colon cancer, lung cancer in their 20s, 30s, 40s. And they're in like stage 4. You're seeing all of these young people just dying from chronic illness where that doesn't necessarily have to be. And they say that we have the best healthcare system in the world, but we have all this chronic illness. And I think they said it was $130 million that we used to spend back in the 70s. And now the amount that we spend in America is $4.9 trillion. That is a lot of money. And if we can save that money just by actually doing some root cause medicine, it will actually save a lot of grief. It will save, it will help with intervention. It would actually bring down that huge healthcare budget. So 3 things. Why? So in America, we have seen obesity go up from, this is back in the 70s. We've seen obesity go up from 13% to 40%. Hopefully you guys can read my handwriting. 40% of Americans are obese now. Diabetes has gone from 1% to 14%. That's a 25 times increase. That's increased by 25 times of the increase of diabetes in America. And autoimmune disorders have uh, gone up 2 to 5 times in America. Vitiligo in particular has gone up 5 times. So usually, I remember when I was younger, I rarely saw anybody with vitiligo. Like even as a child, I don't remember seeing a lot of people. It was very rare that I saw someone with vitiligo. And now, 5 times, vitiligo, the incidence of vitiligo has gone up significantly in America. And I think that has a lot to do with our exposure in our food, our mold exposure, our chemical exposure, our insecticide, herbicide exposure, just the food that we eat, the lack of activity, are the seed oils, are the food, the fast food that we're eating, all of the inflammatory foods that we're eating, whether we realize it that we're eating or not. We're seeing a lot more autism. We're seeing a lot more, of course, chronic illnesses. And so that is the important thing of the why behind vitiligo. And just for us to make it personal, vitiligo happens, it occurs more in Asians, Hispanics, and African Americans, not as much in white Americans or just white, period. But it's definitely, you can see it, it's more prevalent with darker skin. You can pick, it's able to spot a lot easier. And we tend to have a lot more of the chronic illnesses in those groups anyway, such as diabetes and obesity and high blood pressure. And so we also have more autoimmune disorders in those groups. So what I want to challenge you to have you understand the importance of putting that knowledge of functional medicine behind you in order to help cure and to help resolve and to help get you guys healthy. If you want to, some people say, "Well, I love vitiligo. I love the way it looks. I love it." I know there's a big change, and a lot of people are like, "Oh, I love the way it looks on me." However, vitiligo happens because there is an inflammatory process going on in your body, and that inflammatory process is not always so great for you, and it can lead to other autoimmune disorders. And so I wouldn't necessarily sit on the fact, "Well, I have vitiligo, it looks pretty," but there is something going on that needs to be fixed. There is a process in your body that is attacking your cells. It's attacking the cells that make color in your body, and that is a sign that something is definitely going on in your gut. There's definitely something going on, possibly in your the amount of nutrients that you have, maybe genetically. But you need to find out the why behind what's going on, the process that's going on in your body. It's not something that you just have to live with. And so I want to encourage you to really follow, and I'm going to continue guys give you information, continue to give you guys steps to say, first step, this is what you do. Second step, even if you can't get to a functional medicine doctor, I will help you guys along the way. And that's what I'm doing here. So definitely, you guys tune in next time for our next video. Definitely push the like button and follow in order to get notifications, that notification bell. Go ahead and get notifications for the next video coming out. But I'm here to help you. I'm here to help you in your journey, especially us who have vitiligo. I'm here to help in that journey to get us healthier, to make sure that we are addressing any inflammatory processes that we have, so it won't lead to other chronic illnesses. So you guys, I'll look for you next time, look for you next month. We'll continue to put a video out every month, and we will make sure that also, again, if you hit that notification in the description to get on a webinar, to be able to ask questions, and do question and answers live as needed. Hey guys, I almost forgot about answering the comments at the end of the video. So if you do have a comment, please leave a comment at the end of the video. Question you have about vitiligo, I'll answer that question for you. And so one of the questions was the person was trying to get a hold of my office and couldn't get through. If you actually have a question about vitiligo, or if you have a question about chronic illness in particular, I would encourage you to get on the webinar. However, if you're trying to see me as a physician and you would like to make an appointment, you would just call during our office hours, which is 8:30 to 4:30 p.m. Eastern Standard Time, and you would push prompt 1, I think, and that person will either, if they can't get to you at that time, they'll give you a call back and answer your questions at that time. It's the number to the office is 770-954-5010. Again, 770-954-5010. And if you also would like to get in touch with us by email, it's info@harrisinternalmed.com. Again, that's info@harrisinternalmed.com. I will see you guys later. See you next month. Have a great time. Bye.